So today's title is Are Functional Medicine and Functional Neurology Pioneering Modalities for Chronic Lyme Disease? I'm Dr. Martin Rutherford, certified functional medicine practitioner and a chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
For those of you who watch this, we're going to talk about functional medicine, maybe what it really should look like, or what it was intended to look like, maybe would be a better way of putting it. Dr. Gates and I, many of you watch, know that Dr. Gates and I have worked together for a long time and have married the two disciplines of functional medicine and functional neurology to treat chronic diseases, chronic pain, it initially started out with. And eventually, one of the conditions that we've morphed into is Lyme disease, simply by default of treating hundreds and hundreds and hundreds of fibromyalgia patients. Many, of course, as you probably well know, are diagnosed with Lyme, and they were doing well. And we weren't particularly following anywhere close to the normal ILADS Lyme protocol. So this was kind of interesting. And over that period of time, Dr. Gates has done an enormous amount of research, and we're putting together, this is kind of part of a little mini series on Lyme, and then we're going to be doing a no BS series presentation on Lyme in a month or two online, and it'll be quite comprehensive, probably be like an hour long or maybe longer. So really what we're going to talk about here today is that approach. We're going to talk about how we've kind of wandered into this approach. I can almost remember the minute I asked you, it was a patient from up north, or in Reno. This patient, I think, was from Oregon or Washington. And she had come down, not for Lyme, but she had Lyme, had been treated with Lyme. And I don't know if you remember a couple I'm talking about, and they weren't very hopeful. And that was fine. And it was the husband who was really motivated to have her try, because he had been here before. She had been here before, I think, as a chiropractic patient years before, and they trusted us. And anyway, she came down. She did amazing. I don't know about you, but that was the one that really locked it for me, because we weren't treating her for Lyme, and she'd been getting treated for Lyme and spent hundreds of thousands of dollars, and they were just, and all that type of stuff. And I kind of looked at Dr. Gates and said, "Is this like an autoimmune problem?" And he went, "Yeah." And I was like, "Oh my goodness." Now that was years ago, and that was years before last year when it came out, and some of the things that you're starting to quote. Functional medicine is a topic that we've done, and so we'll get to that. But functional medicine is a topic that we've done. I went through all the original functional medicine procedures. I think I studied with the man who I think is responsible for functional medicine, and it's not Dr. Bland, but he needs to get his props. Jeff Bland coined that term, but Dr. Crossing took it to a whole new level. Understanding how systems are involved, talking a lot about autoimmunity, talking about things that really weren't being talked about in the early 2000s and in the late, I think it's early 2000s. And so he's who I give credit for. And I kind of attended his courses. And I feel like I went to them all. I kind of feel like I know what he intended this to be, and I think I understand where it's going. Functional neurology is a discipline that's been around since like the late 70s.
Yeah, late 70s.
Dr. Carrick, and you can elaborate on this. And originally went into dizziness, vertigo, balance, migraines. Concussions back then too. Yeah, he did concussions with.
He did concussions, I think, more around the 2000s, the late 2000s. But he was probably doing it before then. But Dr. Carrick started out trying to explain how the chiropractic adjustment works, because before then we had this antiquated model, of nerves being compressed.
Right.
And then they later found out that really the nerves weren't compressed, but chiropractic works. So how did it work? And Dr. Carrick went into the neurology of how moving a joint really quick could fire certain receptors, and where those receptors fire to, neural pathways to shut off pain. Well, if we can shut off pain, what else can we do? So he started fixing other neurological conditions, like you said, dizziness, balance problems, vertigo, dystonias, traumatic brain injuries. And it turned into really a brain rehab discipline. So yes, some chiropractic neurologists adjust, but a lot give eye exercises and other modalities to try and improve brain function. And we parlayed that into the stress response because we see so many of the chronic Lyme patients go through these massive stress responses, which I'm sure you'll go into.
And we've talked a lot about emotional trauma lately. Well, and we talked before this, and you talked about the stress responses, and I didn't really share and say, I also think that maybe people who get Lyme or get autoimmune problems and things of that nature are already compromised hosts. That might be another point to make. But in the end, Dr. Gates has fine-tuned this protocol dramatically, his protocol to chronic pain and to Lyme disease now, and functional medicine as well. I think the testing that he has done an enormous amount of research is much more fine-tuned. It's actually well received, I think, in the medical community when we work with the medical community when we need to, because the testing is there, but understanding what testing to do. And we did a talk last week on new testing needs to come about. But we're going to talk today about, we've done several Lyme presentations. We've had a lot of interested people who are interested in learning more about it, and we've had a lot of people all out attack us, which is fine. Okay, it's not a problem. So in the end, we thought we'd let you know what we're doing. Like why it's working. What is it? It's working. We screen patients. We screen them. Okay, we have patients come from all over. I talk to patients on Skype. I want to make sure nobody comes here unless I'm pretty sure that if they come here, they fly here, they're coming from another country, another state, and they're not wasting their time or they're not wasting their finances, that they're going to get better. So we screen patients. So in a properly selected group of patients. In other words, we don't take every patient, all right, because we kind of know what type of patient is going to respond to what we do and what we don't do. We screen them heavily. And then in that properly screened and selected group of patients, I don't even want to give a percentage of the patients that do well, because that would probably ruin our credibility. But just know that within that framework, we get consistently a good result. So what do we do? Well, functional medicine, if you want to go into functional medicine, we were talking about how the way I was taught functional medicine is not what's happening out there.
Right.
And that's kind of important, because I've been through phases of consulting folks from 10 years ago to people just coming in out of desperation and hoping we had a new pill, to people coming in and saying Hashimoto's, oh, you're one of those weirdos, to now everybody comes in has Hashimoto's, knows they have it, but it's not getting better, or people are embracing the autoimmune model, or it's just been a massive shift in the way people come into the office these days. And now I'm getting a lot of patients who come in here who've been to functional medicine practitioners, a lot, and they're still sick, and they're still pretty sick. And so functional medicine is a little complex, and functional neurology is very complex. And you put the two complexities together, and what you find maybe is that people are taking bits and pieces of it. There's no regulatory board that says you can call yourself a functional medicine doctor. You can't. Much more stringent on the functional neurology practitioners. But I, as an outsider, will say, I have met very few functional neurology practitioners who are doing what Dr. Carrick told them to do. A lot of them are doing other things, or they're doing a cursory exam and doing very generalized work and stuff like this. So I just say that in case you've already been to one or two or whatever. So
it's a good
presentation.
Well, relative to how this all ties in with Lyme disease, you probably should watch our most recent 3 or 4 broadcasts that we did, where we really highlight that Lyme has evidence that's an autoimmune problem. It's probably why so many of you have neuroborreliosis symptoms. So you have the neurological symptoms of Lyme, yet your testing for Lyme lots of times comes back indeterminate or negative, or maybe you're positive according to this test criteria, but negative to the CDC criteria. Because in other broadcasts, we pointed out that once you're in the chronic phase of Lyme disease, you don't make antibodies to Lyme. And so why are we even doing this antibody testing to Lyme when really the Lyme bacteria has destroyed parts of your lymph nodes, your immune system, so it doesn't really mount an attack against the bacteria. And really what ends up happening seems to be this autoimmune process, which then parlays into what Dr. Rutherford was saying. and how we're treating fibromyalgia patients who've been diagnosed as having Lyme disease, and they had a clear clinical history that, you know, they got bit by a tick, they had a rash, and then they go through our program, and all of a sudden their Lyme symptoms that they'd spent hundreds of thousands of dollars on were nearly gone. How do you explain that? Well, we're going to get into that shortly. Before we get into that, I think we need to talk about the functional medicine landscape, as you were mentioning. We go to functional medicine seminars, so we see all the tricks, the tools, you know, all the toys, all those things that are being advertised to functional medicine practitioners. It's just a natural state of humanity to kind of gravitate towards the easier things. The easier things in functional medicine are to do a gazillion tests. So to run testing on your microbiome, and to run every adrenal stress index and hormone test that you can, and then to run every Cyrex test under the sun that Cyrex offers, because that way you're covering every potential antibody that someone is making, not only to their body, but also to every food out there. And then there's even infectious disease testing now through Cyrex that people are running. And we use Cyrex in a very selective fashion. We really are in favor of Dr. Vajdani's work. But again, testing is meant to be based on a pre-test probability, meaning somebody comes in, let's say a 40-year-old woman comes in with a cough, and she's a smoker. What do you think as a doctor? You need to think maybe she has lung cancer. Okay, let's say a 35-year-old woman comes in who has just traveled to Indonesia, or we could say, let's say Russia, and she comes in with an acute cough. What do you think? Maybe tuberculosis, because she went to an area that was endemic to tuberculosis. So in that situation, you're going to run a test for tuberculosis. The first situation, you run a test for lung cancer. The problem is in functional medicine doctors are running every test under the sun possible that is offered to them at seminars. Sorry, but that's just the truth. Yeah, and many of you are being exposed to functional medicine, and you're not really being exposed to actual functional medicine. You're being exposed to somebody who doesn't prescribe medication, or maybe they do, but they don't like to.
And they're not being exposed to the full framework of diagnosis.
Right. So based on that, they run a gazillion tests that we're testing the microbiome, we're checking all these different things I mentioned. So now you need to take this probiotic based on the microbiome test. You need to take these 5 supplements based on your adrenal stress index and your hormone panel. And you have to take these 6 supplements for your leaky gut, and you have to eliminate 97 foods.
While you're on the diet for autoimmune paleo.
Right, and that's not functional medicine. Functional medicine, as Dr. Rutherford said, is a systems-based approach, meaning you have big dominoes that you want to knock down first. So you focus on one area of their physiology. That may be their stress response, or that may be their gastrointestinal function, or that may be their mitochondria if they have a massive viral infection. But you focus on one area first that has the potential to knock out all the other dominoes. And as Dr. Rutherford and I were talking about before we came in here, he had the privilege to go to one of Dr. Karazian's case study modules. And leading up to this case study module, the case study module was kind of the nuts and bolts, pulling it all together, showing people how to do this. But before that, he had put on all these different seminars on GI stuff, blood chemistry, endocrinology that were packed.
Okay, that was going to say.
But then he puts on this case study module in terms of how you put it all together, and only 13 people showed up.
13, and he was livid.
Pretty
and
upset.
I went to his last one. Apparently this was not unusual. Apparently this was like the 4th or 5th one he did to say, here's how to put it together. I mean, he was literally like almost throwing stuff around, because he's like, this is crazy. You're not going to be able to do this unless you come to this class and learn how to put these systems together in an organized fashion. Otherwise you're just going to be doing like what everybody else is doing. Mm-hmm. And that's what we're seeing.
And that's what we're seeing, especially in the Lyme area. So many of you are seeing Lyme literate doctors who are aware of functional medicine and now are using functional medicine tools. So they may be running heavy metal tests on you. And because of that, you need to get chelated, because that can affect your immune system, they're saying, or hormone protocols or gut protocols. All these different things all at once is alternative medicine. That's an important distinction. There's mainstream medicine, which is giving you a medication for a diagnosis. There's alternative medicine, which is running basically an alternative test or a functional test and giving you a supplement or a chelation or a vitamin for that test. Neither of those are functional medicine. Functional medicine is where you attack really the big dominoes, like we said before. What we've seen with the Lyme patients is that many of you are in a chronic state of stress. Possibly that stress stems from the fact that you've had nothing but negative results from your healthcare. So many of you
Financial.
come in expecting the next shoe to drop in terms of your health. You've spent so much money without results. And so you're just waiting for the next thing to not work. That's what we've really seen.
And you're wondering where this is all going.
Yeah, and so
What's my life gonna
you're
look
30
like
years
3 years
old,
from
you're
now?
40 years old, you're 50 years old. Yeah, and where's your life going? So that puts the body into this chronic state of fight or flight. That chronic state of fight or flight then has a tendency to secrete all these stress hormones that not only damage the frontal lobes, which can perpetuate depression and fatigue, but also those stress hormones damage your gut. Your gut's already been damaged most of the time because you've been on antibiotics for a year to 6 years. And so then patients come to us and we apply our functional medicine and functional neurology principles of basically getting your frontal lobes functioning better again to shut off the stress response. And then we go in and we laser focus on your gut until your gut is healed. We don't really branch out anywhere else. And that doesn't involve us doing 27 Cyrex tests. That involves us figuring out your intestinal permeability, figuring out the right diet for you and your microbiome, and then slowly repairing these areas. And what we found, then sometimes, yeah, we need to go into the adrenal glands, or yeah, do we need to use a neurotransmitter supplement, or yeah, do we need to use some mitochondrial rehabilitation? But invariably not nearly as much, like 1/10 as much is what we see being
Yeah,
done
if you're
out
doing
there.
this right, our mantra is less is more.
Right.
Less, more targeted. But you can only do less, more targeted therapeutic clinical treatment if you understand the systems of the body and you understand diagnosis. I mean, it really comes down to that. I think a lot of these tests have come out. I think people are taking it. I think the testing world is taking advantage of doctors who don't really go to a course. They go to the course. Maybe it's a day course. Maybe it's a 3-day course. Maybe it's a couple of weeks that they go on weekends or something like that. But they don't really grasp overall true diagnosis. So then we have all of the what do they call them? Specialty tests. Is that what's called?
Yeah,
specialty tests. All the specialty tests. Not saying none of them ever have any validity, but they can be red herrings. They can go off in different directions. Many of them are not very specific, not very sensitive. In other words, not very accurate. But the doctors are going to embrace them because it's like, okay, I can do this test, and I can do this test, and I can do this test, and then I can give you supplements, I can give you a diet. And if it doesn't work, then we can do this test. And that's not the way that functional medicine was supposed to be. That's not the way your body works. And it's usually a recipe for failure. That if you start getting that approach, oh, now we're going to try this, and now we're going to kill this, and we're going to, that's going to be a failed model. I mean, most of the people who have done well in Lyme, the ones with me, they go like, I went in, I got in early, I got the antibiotics, and I got over it. Mm-hmm. But once it seems like it gets past there, this seems to be the model. And it seems to be that what does that sound like? I went to the doctor and he gave me this, and then it didn't work. And he took the test and he told me I was normal. So he told me I'm not going to give it. It sounds like the medical model. And this is starting to look a lot like the medical model to me. Mm-hmm.
Which is not the functional medicine
this
model.
This alternative Lyme model. Right. I'm like, okay, we're gonna kill the bacteria, we're gonna kill the co-infections, we're gonna do the metal, we're gonna do it just.
Yeah, and just for the record, we don't even like the term functional medicine because we feel that doesn't really.
I like the term. I just think that.
Well, part of the problem is, that we have so many people now doing functional medicine, not really doing functional medicine. So it's like it doesn't mean anything. We need a new term. But anyways, I think that's really the point. And so the point is that most of you have autoimmune problems. That's what we're finding. Yes, the studies are done on the Lyme arthritis patients, but frankly, what we see is that once you get these cytokine imbalances, meaning once the immune system is out of balance and there's a lot of inflammation in the immune system where it starts attacking you, these inflammatory chemicals go into the brain, cause a variety of symptoms from brain fog to fatigue, which a lot of you suffer with, to depression, to pain, to even hypersensitivity reactions to pain. And then we can calm this down. What we've seen in the Lyme patients we treat, invariably, not 100%, but pretty high, where we are able to calm down these immune responses by really attacking the gut and attacking these stress responses.
Yeah, if you have stress responses, if you're in chronic fight flight, can't go to sleep, wake up, can't go back to sleep, anxiety for no reason at all, night sweats, tremors, all those types of things. If you're like and panic attacks, all those. If you're like a worrier, if you're like a perfectionist, those types of things. If you're in fight flight, if you get a bad gut, I don't care what it is. I don't care if it's anything from irritable bowel to Crohn's disease. Okay, and that's a wide spectrum. If you have an autoimmune problem confirmed, or somebody told you got autoimmunity, or if you have rheumatoid, almost any type of autoimmune problem, you have an immune system that's flaring up and hitting you, and particularly if it's a thyroid, you calm all that down, and you're gonna feel like enormously better. But you have to do it in an organized fashion.
Right.
And you can't just be throwing things at them and taking bags of supplements. And in fact, most of the patients we know that do that, it makes them feel worse.
Yeah.
So.
Well, we appreciate you watching. We'll be back next week with another broadcast on Lyme. We'll probably do 3 or 4 more. And we hope you found this helpful. Send us any questions you have on other topics you want us to talk about. We can't answer personal questions, but topic questions.
Feel free to attack us. It's always good to see where everybody's at on these things. It's like, oh, okay, that's what they're thinking. So, okay, well, whatever.
All right, we'll see you next week.
Okay, bye.